I recently have adopted using the Mako robotic software and system for the anterior hip. A nice thing about the anterior hip is you can do it with a patient lying on their back. So it's easy to take an x-ray and kind of have a live feedback while you're doing the surgery. So that allows you to do a lot of things with implant positioning and leg lengths and all those things. The two goals of a hip replacement are to establish or reestablish the length of the limb and what's called the offset, or kind of the lateralization of it. Well, I kind of started losing my satisfaction with just kind of eyeballing it on an x-ray. And I've always used the robot for knee replacements or partial knee replacements. So we started looking at it with the robotics for the hip, and they had a new stem coming out that was going to be much improved and a little different, and they had a new software coming out. We've been doing it now for about 3 months, and to be honest with you, the technology for being able to plan the surgery before we even walk in the operating room, the 3D CT scan detail, and being able to change positions of components by 1 millimeter or 1 degree before we even make an incision is just, it's unlike anything else that we're able to do. And then once we're in the surgery, if there's a little change or we need to make some adjustments, we can still make those adjustments, those small little incremental adjustments that nobody could do with their naked eye. We can do it before we even proceed with the surgery. It also allows us to make sure that our leg lengths are perfect within a millimeter. I could never do that without the robotic system. So I think currently right now, as far as I know, I'm the only surgeon in Columbus or Central Ohio that is doing robotic anterior hip replacement for all of my patients. There are some that do it for there are certain cases that you would use the robotic software for, and I had done that in the past, but I believe in it strongly enough now that we offer it to every one of my patients, and I'm pretty sure right now I'm the only surgeon in Columbus that's doing so.